Hi, my name is Carl Hansen. I am a physical therapist with St. Alphonsus Medical Center in Baker City, Oregon. And I'm here today to actually talk to you a little bit about low back pain and some exercises you actually can do within the gym setting to prevent low back injuries. First of all, I want to thank the YMCA for allowing us to show these videos on their website, just as this is a great opportunity for education with the community. So first of all, some statistics about low back pain. Based on the Arthritic Foundation in 2007, roughly 50 to 80% of all American population will actually experience low back pain sometime in their lifetime. Within a given year, approximately 10 to 15% of people will actually experience low back pain, and over $24 billion are spent per year on low back injuries alone. And so it's really important that you do actually have some exercises to perform so that you can actually do some things to prevent yourself from having low back injuries. First of all, if you are having low back pain, you do need to talk to a healthcare provider, especially if it's been going on for more than a couple weeks, to discuss about possibly things you can do, such as physical therapy or other forms of treatment. And second of all, if you are having any pain with these exercises I show you, you need to actually stop these exercises and actually talk to a healthcare provider before you do them. So one of the first things I'm going to show is just a couple stretches that you can actually do. One of the first stretches that's really important is the hip flexor stretch. And the reason the hip flexor stretch is so important is because where the hip flexor actually attaches, it attaches into your back and then onto the femur bone. And because the hip flexor actually becomes tight, it can actually cause us to get into this flexed position. A lot of times people will go through the gym and do crunches and do a lot of ab workout, but what they end up actually doing is overstrengthening the hip flexor and actually tightening it down. So a quick stretch to do is what we call the hip flexor stretch. And the position that you actually want to be in is in a half kneeling position. And as you look at this position, most people will just go through and do a stretch like this, and you actually don't engage the hip flexor at all. What's really important is, first of all, as you do this stretch, is actually to pull your abdominals in, hold them tight, just like you're sucking in, tighten the butt muscles up, and what that does is actually puts tension on the hip flexor. And from that position, then, you go into the stretch, and you actually feel a stretch right into the groin, kind of into the hip region right here in the front, okay? When you do these stretches, it's important to hold them for about 30 to 60 seconds. And the best time to actually do them is actually after you've had a good warm-up. Second stretch is important, as we look at it, is the hamstring stretch. And the reason the hamstring stretch is so important is as the hamstring attaches below the knee, it actually attaches up into the butt, and tight hamstrings can again cause us to go into that flex forward position, putting excess strain onto our low back. So an easy stretch to do is coming into a position here, straightening the leg up, and getting that stretch in the back of the hamstring. Other ways you can do it, you can see the way that the runners do it is here in this position, straightening the leg. But the most important part about it is the same thing. You want to basically pull the abdominals in tight, keeping your back straight, and then lean forward to get the stretch, and not letting yourself go into a position where you're just bent over, but instead keeping yourself straight so you get that stretch into the leg. Okay, and then the last stretch is actually a good stretch to do for your low back, is what we call the prone press-up. And the reason this is because it mobilizes the back and actually does a lot for your back. Position-wise, you go here, keeping your pelvis on the ground, you actually come into a slight push-up. Holding that for about 5 to 7 seconds, and then just slowly going back down and coming back up. Now the thing you want to make sure is that you're not overarching and putting too much pressure on the back, but it should be a nice, gentle stretch, felt. Couple of strengthening exercises. What you can look at doing is we talk a lot about the core, and everybody's got it caught up into this core strengthening, so they're going to the gym, they're getting on the ball, they're hitting lots of abdominal exercises and doing things like that, but really the core comes down to a main muscle called the transverse abdominis. Even though the obliques, other muscles play a really important role, there's some specific exercises you can really do to really strengthen up this core area. One of them is called the plank, or a lot of people like to call it the pillar. And in this position, you can actually come to right here, holding onto your elbows on your toes, pulling your abdominals up tight, hold yourself into this position. Now the thing that's important about this position as you hold it, as you don't want to let yourself sag down too low or be up a high position. It should actually be almost like a straight board. And then you're holding your abdominals tight. Another one that's cool is that you can actually do is the side pillar to really hit these oblique muscles that tie into the back. And so what you want to look at doing is being in this position here on the side, Keeping yourself straight, raise up into a side pillar position. Now, a lot of times people will start leaning too far forward, or they'll let themselves drop down too far, but you actually want to try to keep yourself in a straight line. And then one last one that's actually kind of a good one to do is actually to strengthen up the what we call the multifidi musculature, which right attached into the back too as well, is a position right here, taking your hands and just doing a little bit of a opposite arm, opposite lift to start kicking in the muscles into the low back. Now these exercises, again, if you're having any pain with them, first of all, you need to talk to a healthcare professional about what's going on and why you're having pain. And second of all, these exercises are just to help basically strengthen the back, to stretch the back out, to help prevent injuries. That doesn't mean that you don't need to focus on what you're doing, how you're lifting things, how you do things, because basically what happens is that the mechanics of how we lift, how we move, can cause extra strain to our back and lead to injuries. If you do have any questions, it's always important again to talk to a healthcare professional. And again, I thank you for this time, for allowing me to share some knowledge and to possibly giving you even ideas for exercises that you can do within the gym setting.